CDC loosens coronavirus guidance, signaling strategic shift. The Centers for Disease Control and Prevention on Thursday loosened many of its recommendations for battling the coronavirus, a strategic shift that puts more of the onus on individuals, rather than on schools, businesses and other institutions, to limit viral spread. No longer do schools and other institutions need to screen apparently healthy students and employees as a matter of course. The CDC is putting less emphasis on social distancing. Its quarantine rule for unvaccinated people is gone. The agency's focus now is on highly vulnerable populations, and how to protect them, not on the vast majority of people who at this point have some immunity against the virus and are unlikely to become severely ill. The new recommendations signal that the Biden administration and its medical advisors have decided that the lower fatality rate from COVID-19 in a heavily vaccinated population permits a less demanding set of guidelines. The current conditions of this pandemic are very different from those of the last 2 years, CDC epidemiologist Greta Massetti said Thursday in a briefing for reporters. CDC officials have repeatedly pointed to greater protection against the virus because of high levels of vaccine and infection-induced immunity in the country, coupled with the rollout of effective treatments that have reduced severe illness. A report released Thursday by the agency explaining the guidance revision said the more favorable circumstances allow public health officials to focus on sustainable measures to further reduce medically significant illness as well as to minimize strain on the healthcare system, while reducing barriers to social, educational, and economic activity. But the revision in guidance carries some risk. According to infectious disease experts, another fall and winter wave of cases, or the emergence of a new coronavirus variant, could call into question the wisdom of the CDC's strategic pivot or hamper the agency's ability to reimpose tougher guidelines under the new guidance. Quarantine procedures have been relaxed. Unvaccinated people who have had close contact with someone who is infected no longer are advised to go through a 5-day period of quarantine if they have not tested positive for the virus or shown symptoms. Previous CDC guidance said people who had been exposed but were up to date on their coronavirus shots could skip the quarantine period. The new guidance expands that standard to everyone. The updated CDC guidance does not call for dropping all precautionary measures. For example, people who have been exposed, but not confirmed to be infected, should still wear a mask and get tested at least 5 days after exposure. People who test positive should continue to isolate immediately and stay home for 5 full days if positive. Isolation, as opposed to quarantine, covers those known to be infected or who are symptomatic.